Welcome to The Explainer. Today, we're diving into a really strange and frankly dangerous connection inside the human body. We're going to explore a condition where a sick liver can quite literally suffocate you.
I mean, it sounds impossible, right? The liver is all the way down in your abdomen, the lungs are up in your chest. How on earth can a problem in one basically choke out the other? Well, that's the mystery we're cracking open today.
So this condition is called Hepatopulmonary syndrome, or HPS for short. And for doctors to diagnose it, they need to see this specific triad of problems all at once. First, you've got to have liver disease. Then, the tiny little blood vessels inside the lungs start to widen, and not just a little bit. And third, all of this leads to the most dangerous part. Your blood oxygen levels get dangerously low.
So, how does a process like this even get started? Well, it all begins with this very strange, very real connection between the liver and the lungs, which is basically a massive breakdown in your body's communication system. You know, you can think of it like this. A healthy liver is a master filter for your blood, but when it gets sick, it just stops doing its job properly. This creates this huge imbalance of chemical signals that start flooding your body. And your lungs, which are incredibly sensitive, pick up the wrong message, a signal that basically tells them to open the floodgates. And that brings us to the core of the problem. These mixed signals from the body, and how they just wreak havoc on the lungs.
Okay, so here's the play-by-play. The sick liver starts pumping out way too many substances that widen blood vessels. A key one is nitric oxide. These signals hit the lungs and tell the tiny capillaries to expand, a lot. All of a sudden, blood is just rocketing through your lungs. Normally, red blood cells kind of drift slowly past the air sacs, giving them plenty of time to grab oxygen. But in HPS, it's like they're being shot through a fire hose. They're moving way too fast to pick up the oxygen they need.
And the scale of this change is just staggering. A normal lung capillary is tiny, maybe 15 micrometers wide. That's just wide enough for a single red blood cell to squeeze through. But in severe HSPS, these things can balloon up to 500 micrometers. That's not just a minor adjustment, it's a complete, disastrous redesign of the lung's entire plumbing system.
So, with such a crazy change happening on the inside, how do doctors actually figure this out? Well, this is where some pretty fascinating medical detective work comes into play to solve this breathing mystery.
The main symptom, not surprisingly, is shortness of breath, what doctors call dyspnea. But as our source material notes, it's often insidious, which is just a fancy way of saying it sneaks up on you. At first, patients might just feel a little winded climbing the stairs, but it just gets worse and worse over time. But here's the single biggest clue, and it's a very strange one. With most lung problems, people have a harder time breathing when they lie down. With HPS, it is the complete opposite. Patients actually feel more breathless when they stand up. This bizarre symptom is called platypnea, and it happens because when you stand, gravity pulls more blood into those super dilated vessels at the bottom of your lungs, making the oxygen problem even worse. So this bizarre symptom is a huge red flag for doctors. To confirm what they suspect, they use a test with a fantastic name, the bubble study. Officially, it's a contrast-enhanced echocardiography, and it is the gold standard for proving that these lung vessels have gone completely haywire. So here's how this clever test works. Doctors inject a saline solution full of tiny microbubbles into an arm vein. Now, normally, the lungs capillaries would just filter these bubbles out, no problem. But in HPS, the vessels are so wide that the bubbles sneak right through, travel to the other side of the heart, and pop up on the ultrasound. Seeing those bubbles appear is definitive proof of what's called a shunt, a shortcut where blood is just bypassing the whole oxygen exchange process.
So once HPS is diagnosed, what can actually be done? This brings us to the treatment. And unfortunately, the options are pretty stark. There's really only one proven cure.
The crucial thing to get here is that there's a huge difference between managing symptoms and actually finding a cure. Yeah, giving a patient oxygen can make them feel better, but it doesn't fix the underlying problem. And right now, there are no effective drugs for HPS. The only treatment that can actually reverse the damage is a liver transplant. It makes sense, right? Once you replace the sick liver, the body stops sending out those faulty signals and the lung vessels can finally start to heal.
This makes the prognosis for HPS incredibly serious. It also highlights why getting that diagnosis early is so important. So let's look at the outlook and then wrap up with the key takeaways.
And this right here, this is where the reality of HPS becomes absolutely terrifying. Patients who just have chronic liver disease have a median survival of about 41 months. But the moment HPS develops, that number plummets to less than a year.
It's not just some side complication, it's a ticking clock that makes getting a liver transplant an urgent, desperate race against time.
So let's just recap the big points. Hepatopulmonary syndrome is a severe lung complication that is directly caused by a failing liver. Its most unique telltale symptom is that plapnea, getting short of breath when you stand up. The go-to diagnostic tool is the bubble study, and the only thing that can actually cure it is a liver transplant.
You know, the story of HPS is such a powerful reminder of how interconnected our bodies truly are, that a sick organ in one part of your body can have these profound and totally unexpected consequences somewhere else. It really leaves you wondering, what other hidden connections, what other secret conversations are happening inside all of us right now?